Since arriving in the 1880s, Palm Beach County's physicians have led the way in transforming the healthcare system, from the age of house calls to an era of sophisticated specialized care. Over the years, doctors helped pave the way for improving the quality of life for the masses and helped put our community on the map for groundbreaking medical research and outstanding care. And through it all, Palm Beach County Medical Society has served as the inspiration, guidance, and support for physicians. It all started on a muggy afternoon in 1919 in West Palm Beach when 19 physicians founded the organization. The doctor's first order of business was establishing a fee schedule. West Palm Beach calls were $2 and out-of-town calls were $3. The early doctors included William Ernest Van Landingham, who served as the superintendent of Good Samaritan Hospital, and John Robert Carson, who cared for people from Palm Beach to Pompano. There was also Thomas Leroy Jefferson, an African-American physician who arrived in West Palm Beach to treat African-American workers during the construction boom, fueled by the expanding railroad. As the country expanded, the demand for physicians grew even more. After the horrendous hurricane of 1928, doctors worked for months to care for the survivors of the storm, which killed 2,000 residents in the Glades region. One of Palm Beach County's best-known physicians was Carl Brumbach, who in 1950 started the county's health department and expanded it into one of the largest and most effective in Florida. His leadership led to significant improvements in sewage treatment, mental health services, and health care for children, migrant workers, and African Americans. By that time, the medical community was hard at work in meeting the needs of Palm Beach County's fast-growing population. New hospitals opened in Boynton Beach and Boca Raton. And the start of Medicare and Medicaid programs enabled thousands of new people to gain access to health care. As the country continued growing, the Medical Society took on major causes important to doctors in the 1980s, 90s, and into today: malpractice care, HMO expansion, and diminishing salaries due to insurance reimbursements. They flew to Tallahassee and Washington and marched in white coats to demand their voices be heard. Doctors also stepped up the fight for equality of their patients. At the Medical Society, they created Project Access to provide volunteer care to the growing numbers of uninsured people. When public health problems surfaced, physicians working at the health department and newly formed healthcare district of Palm Beach County delved in to find solutions. Dr. James Howell, for one, worked with many agencies to reduce an HIV/AIDS crisis in the Glades region in the mid-1980s, which made national news. Years later, other physician leaders pushed for a new medical school at Florida Atlantic University to address the need for more local doctors to care for a growing elderly population. Today, more than 1,500 physicians are part of Palm Beach County Medical Society. And as the next generation of physicians takes over, one thing will remain unchanged. The tradition of caring will remain strong, thanks in large part to the Medical Society.